Local anesthetic agents are drugs that reversibly block nerve transmission, and they are used to provide anesthesia to specific areas of the body and can be used for analgesia. Local anesthetics also affect transmission in motor nerves, hence motor weakness may occur following a local anesthetic depending on the site of application. So adrenaline is added to local anesthetics to delay absorption and thus prolong their action. The usual concentration of adrenaline added to a local anesthetic is 1 is to 200,000. Local anesthetics with adrenaline should never be used where the blood supply is by end arteries. For example, should not be used for digital nerve blocks. It are also contraindicated in intravenous regional anesthesia as IVRA. Commonly used LAs in our sub-regional lidocaine or lignocaine and bupivacaine, lidocaine or lignocaine. The advantage is rapid onset of action, duration about 1 hour. Maximum dose of plain lidocaine is 3 milligrams per kilogram, approximately 200 milligrams in adults. Also, maximum dose of lidocaine with adrenaline 7 milligrams per kilogram. Lidocaine is not recommended for spinal anesthesia. Bupivacaine, so the advantage is long acting, disadvantages cardiotoxic, slow onset of action. Maximum dose is 2 milligrams per kilogram for both plain and with adrenaline added. Bupivacaine should be used with caution. Apart from general resuscitative measures, intralipid 20% is effective for the treatment of cardiotoxicity. For ropivacaine, the advantage is long acting and also less cardiotoxic, and the maximum dose is 3 milligrams per kilogram. The uses of local anesthetic agents: topical, local infiltration, nerve blocks, intravenous regional anesthesia, spinal anesthesia, subarachnoid block, epidural anesthesia or analgesia, nebulization for anesthetizing upper airway. Also, in intravenous preparation of lignocaine used as in antiarrhythmic. Also, prevention of local anesthetic toxicity. So always aspirate before injecting to prevent inadvertent intravascular injection. Do not inject large volumes at a time. Caution when injecting into areas of high vascularity. The symptoms and signs of local anesthesia toxicity are perioral tingling, tinnitus, lightheadedness, visual disturbances, slurred speech, altered consciousness, seizures, loss of consciousness, respiratory arrest, also hypotension, cardiac arrhythmias, cardiac arrest. The treatment of local anesthetic toxicity: stop injection of local anesthetic agents, and also start ABC, airway breathing, circulation of resuscitation. So ABCs of resuscitation: you give 100% oxygen if necessary, you intubate patients, you give midazolam 3 to 5 milligrams or diazepam 5 to 10 milligrams to treat seizures, and if seizures persist, anesthetist can give thiopentone as 1 to 2 milligrams per kilogram or more midazolam and paralyze, intubate, and ventilate patients. We treat cardiovascular instability with IV fluids, inotropes, and when bupivacaine or ropivacaine has been used, you give intralipid 20% using regimen. And if cardiac arrest occurs, you start CPR and call for help. So use of 2% intralipid in treatment of local anesthetic toxicity. I'm following bupivacaine or ropivacaine. In addition to Other resuscitative measures outlined: you give an intravenous bolus of intralipid 20%, that's 1.5 milliliters per milliliter per kilogram fast, approximately 100 milliliters for a 70 kilogram patient. You start an infusion of 20% intralipid at 0.25 ml per kilogram per minute, approximately 400 milliliters over 20 minutes for a 70 kilogram patient. Repeat initial bolus twice at 5 minutes interval if adequate circulation has not been restored. The maximum dose of 12 milliliters per kilogram of intralipid 20%, and this should not be exceeded.